next section, we are going to look at blood-borne pathogens. We frequently work in close proximity with athletes and other individuals, and we have the potential for exposure to athletes' blood-borne pathogens. One means to acquire blood-borne pathogens is through direct contact from somebody that's already infected in their blood or other bodily fluids. Now, when we look at blood-borne pathogens, the U.S. Department of Labor's Occupational Safety and Health Administration, or in other words, OSHA, has defined blood-borne pathogens as microorganisms in the blood that cause disease. These are also found in other bodily fluids such as vaginal secretions, semen, cerebrospinal fluid, and synovial fluid. When we work with individuals, we need to be careful and we need to make sure that we treat everybody in the same manner. We need to always consider that our athletes may have acquired a blood-borne pathogen and we need to treat them appropriately while also protecting ourselves. One means to protect ourselves from blood-borne pathogen infection is to assume that all athletes or all patients are passive carriers. By assuming that everybody is a passive carrier, we can use personal protective equipment appropriately, and we need to use it at all times. Personal protective equipment includes items such as disposable gloves, protective eyewear, face masks, and gowns. We will be looking at the three most common blood-borne pathogens. These are HBV, HCV, and HIV. The first one we'll look at is hepatitis B virus, or HBV. Hepatitis B is a blood-borne pathogen that was originally thought to be found in the blood and transferred through open wounds. Now we know it can be found in other bodily fluids, such as synovial fluid and cerebrospinal fluid. Now, what we have to be cognizant about with hepatitis B, that it can exist in dried blood for approximately 1 week. So we need to make sure that we clean up areas that have blood in them, just in case that hepatitis B virus is in that blood. Another cause of concern is that athletes can be HBV passive carriers for years. They will not know that they have acquired HBV unless the athlete discloses to you that they have it. When an athlete is infected with this virus, the virus travels to the liver, where it infects and multiplies over approximately 6 weeks to 4 months. When we look at the signs and symptoms of HBV, we see that infection includes continual fatigue, weakness, loss of appetite, and nausea. Athletes may also complain of constant headache and abdominal pain. They may also have fever, have jaundice, which is the yellowing of the skin and whites of the eyes that can be caused because of liver inflammation. They can also have dark-colored urine and light-colored stools. When we see these things, we need to make sure that we refer them to a physician as soon as possible. For many athletes, the body eliminates the virus and the athlete undergoes no further illnesses. For some, however, HBV turns into a chronic infection that affects the liver, and over years, it can destroy the liver, causing liver cirrhosis, cancer, and eventually death. The good news is that HBV infection has declined because healthcare providers are being more cognizant and aware of the methods of transmission, and because of the benefits of the HBV immunization and making the vaccine more available to the public. The second virus that we're going to look at is hepatitis C virus, or HCV. HCV is also found in the blood, and it can be passed from person to person via openings in the skin similar to HBV. It has been deemed that this is the most common chronic blood-borne infection in the United States. This is different than HBV because most times this is seen in transmission via open wounds and most commonly by passing and sharing contaminated needles. The incidence of this transmission through transfusions is rare, and we know that HCV, like HBV, can live outside the body almost longer than a day. So we look at between 16 hours and 4 days of being able to live outside the body. So we need to make sure that we also clean up bloods for HCV like we do for HBV. When we look at signs and symptoms of HCV, Many of the signs and symptoms of HCV infections are the same as HPV. First, individuals usually produce flu-like symptoms, and other signs and symptoms you'll see include jaundice, joint pain, dark urine, and clay-colored stools. So similar to HPV, but some of the ones are different as well. However, we need to make sure that most cases, 3/4 of cases, the person is asymptomatic. They will not know that they have HCV, and you will not know that they have HCV either. A person that is infected with HCV can sustain only minimal damage. In many cases, an athlete develops serious liver disease such as cirrhosis or liver cancer, similar to HBV. However, it may take up to 20 or 30 years after the initial infection for the liver to develop these serious diseases. Unlike HBV, there is no vaccine or immunization that exists for HCV. The last one we will look at is human immunodeficiency virus, or HIV. HIV is found in blood and bodily fluids such as semen, vaginal, and cerebrospinal fluids, similar to the other viruses that we've already talked about. HIV has also been shown to exist in sweat, saliva, and tears. However, there is no evidence that exists that these bodily fluids cause HIV transmission. Similar to the other two viruses, HIV enters the body via an open wound or mucous membrane by direct contact with an infected individual. The HIV virus invades a healthy cell and lives in these cells in order to replicate. As they live in these cells and begin to replicate, the virus destroys the helper cells, or T lymphocytes, most commonly known as T cells. When this happens and the T cells are destroyed by the HIV virus, the body cannot protect itself against other illnesses and diseases. Over time, the immune system is destroyed. This is the sequence of events in HIV infections that was just talked about. You can see that the HIV invades the helper T lymphocytes, the virus proliferates or grows and begins to replicate, the body forms anti-HIV antibodies, then there's a progressive destruction of the helper T cells, and then our immune system, for those that are infected, collapses. Signs and symptoms, like the other viruses, mimic the flu for about 1 to 2 weeks. HIV individuals will cause acquired immune deficiency syndrome, also referred to as AIDS. When we look at AIDS, the length of time for an HIV-infected athlete to develop AIDS varies across athlete to athlete, but it can be up to 8 to 10 years. There are 3 stages that you can read about in the textbook about AIDS, from primary HIV infection to the asymptomatic stage to the symptomatic stage. The athlete exhibits significant weight loss throughout these stages and symptoms of opportunistic infections, which are illnesses or diseases that invade the body of the athlete who has AIDS. When this occurs and the athlete has been diagnosed with AIDS, his or her body will not be able to fight against any of the infections due to its significant immune system damage.